Okay, I see it's a little bit of late arriving crowd, but the hour is late, so we'll have to start. Come again, Lila Nishmas, Yehuda Shimon, Zafran Baruch ben Yeshua, Yasser Moshe, and Aryalev, Zafran Baruch ben Yeshua, Adam, Zalman, the Shama should have an aliyah. Okay, trying to get through to finish up Hilchos Refua. So I think we left off last week with taking care of cuts. We were discussing Band-Aids. So we had said that when you put a Band-Aid on Shabbos, so what you should do is when you're putting both ends of the Band-Aid, so normally, let's say the Band-Aid's on the finger, so what you do is most people wrap the Band-Aid and they stick the Band-Aid to itself, the two ends to itself. We said you're not supposed to do that. It's preferable to both ends of the Band-Aid should be stuck to the skin. Meaning, so you put one end here, and then when you wrap it around, then glue the other end, let's say over here, so that you're not sticking it to each other. But there are makilim on that too, because it can't possibly be considered sewing, since it's not a permanent Band-Aid. That Band-Aid is going to come off pretty soon. We said that extends itself to those that when they change diapers, so they throw out the diapers, and then they want the diaper to go neatly. So after the diaper is changed, so the dirty diaper, they fold it over and they put the tabs and they stick them back. So some place can say that shouldn't be done either, because it's going to stay like that forever. Shlomo Zalman Rambam says it's fine, because it's you don't care about it. You're throwing it in the garbage, so it's a meaningless thing. Okay, so now let's sticking with cuts. Okay, so now there's a lot of confusion as to what happens when somebody cuts themselves as it pertains to stitches. Okay, we won't spend that much time because hopefully it's not really so nageya. But if you have a cut, if somebody has a cut, then really you should find out if the cut is life-threatening. And in order to go to the hospital, in order for a yid to do stitches, the cut has to be life-threatening. If it's not life-threatening, then a yid is absolutely not allowed to do the stitching on Shabbos. Right? That means even an irreligious yid cannot stitch on Shabbos unless it's life-threatening. Now, how would it be life-threatening? It's just a cut. So obviously, depending on where the cut is. But what some say is if the cut will get infected, so then it can then go, the infections can spread. So that's why many people say that all these types of cuts are life-threatening. It's really, really debatable if that's true, but I'm not a doctor, so I'm not here to discuss it. But it really should be decided by a doctor, not necessarily a EMT or something like that. Right? However, like we discussed, for a chayla, a non-Jew is allowed to do any work. So therefore, you would be allowed to get the stitches done by a non-Jew. So if you go to the hospital, in order to get stitches, so you could just assume that the majority of people in the world are non-Jews, and therefore whoever's going to be stitching the child, or usually it's the child or anybody who's doing the stitching, you could assume that are a non-Jew. You're not really required to ask. The only thing is maybe there's a much higher percentage of Jews as doctors. So okay, so that's debatable whether that goes or not. Now, what's sad but interesting is that a lot of times, because the intermarriage is so high, so the doctor comes in with a Jewish name, a lot of times those are the non-Jews because their mothers are not Jewish. Their father's Jewish, so they're going with the father's name, but the mother is not Jewish. Like a lot of times people say, oh, the guy's name is Schwartz, so it must be that he's Jewish. No, unfortunately, it's his father's Jew, and his mother is not Jewish. So that's just because the last name you can't necessarily understand, unfortunately. Okay, so again, the only time a yid can stitch on Shabbos is if it's life-threatening. If it's not life-threatening, then the Yid is not allowed to stitch, even if he's not from Yid. Right? The same thing is you're not allowed to take an ambulance that's driven by Yidden or a car driven by Yidden to the hospital if it's not life-threatening. If it's life-threatening, then you're allowed to. You can, though, yes, have a goy drive you for the stitches to the hospital, and you can have a goy stitch it up also. Right? How about the butterfly stitches? So butterfly stitches is like a sophisticated band-aid. So that's that would be allowed to be put on. That's not considered like making a knot. Again, I should have said the reason why stitches are a problem because stitches is a knot, and it's a permanent knot. It could theoretically be a permanent knot, even if it's dissolvable. Certainly, if it's dissolvable, and it could be a permanent knot. Being made on Shabbos is not allowed unless it's for a sakana because it's a malacha. Right? Okay, so that's basically the halacha with cuts. Once we're on the subject, because that you're allowed to ask a guy to do malacha for anybody who's sick, even if it's, again, I think we discussed it a little bit, but anybody who's sick, you're allowed to ask a guy to do whatever you want. And again, when you're asking the guy, you don't have to hint, you can say straight out, whatever it is that you want the guy to do can be said straight out, right? So if the patient wants the lights on, lights off, just ask the guy straight out, turn the lights on, lights off. If you want the heat on, air conditioner on, just tell the guy, please turn on the air conditioner. If you need a guy to even get food or medication, that's also allowed. Right? They can go drive it. They take the car. If you have a cleaning lady or whatever it is, or a babysitter who has their own car, and the kid let's say it's a kid that's a chayla or an adult that's a chayla that decides, oh, I really need a tea. You have no tea. Send them in the car to go get the tea. It's no problem, right? Same thing with blood. If somebody needs their blood to be taken, then you can also ask a non-Jew to do that, right? And even if there's nobody else to cook, and the chayla wants something hot to eat, then there's a heter, even though it's bishul akum, right? Even though it's bishul akum, but you were allowed for a chayla. We allow bishul akum. Bishul akum is issa d'Rabbanan. For this issa d'Rabbanan, we allow it for the chayla for hot food if it's on Shabbos. Then after Shabbos, the food already is not good, because then it's only because a Yid can't cook the food on Shabbos. Obviously, it's also for a Yid to cook food. So you're allowed to ask a guy to cook the food for you on Shabbos, but Motzei Shabbos, that food can't be eaten by Yidden because it's bishul akum. In most scenarios, obviously, ask the question if you really need it. So that's basically that for asking non-Jews. Again, it doesn't have to be for somebody who's really, really sick. It's just anybody who is defined as bedridden or sick enough to be that it's bothering their whole body, which means that they're not really functioning. So then that would be enough to ask a non-Jew to do anything. Right? The only thing is, and this is a little bit, I don't want to say controversial, but it can cause a little bit of a ruckus, is that if you can get whatever it is that you need, whatever malacha you need to get done, and you can do it without somebody doing malacha for you, even if a non-Jew is doing malacha, then you're mechuyev to do that. Right? Even if it's going to cost you a lot more money and can take up a lot of time and energy, right? Meaning, what would be an example? Somebody needs a medication on Shabbos. and you have let's keep it simple. You have a sibling that lives a half-hour walk away that has that medication, and it's not an emergency to get the medication. Or let's say it'll take the guy to drive to the pharmacy, 10 minutes drive to the pharmacy one way, 10 minutes back, so they buy it, right? And then you do that. That's one option. Or you take a walk. It's a half hour each way to get the medication from somebody who you're comfortable borrowing it from. So you'd be mechuyev to do the walking, even though the guy would be a whole lot easier to ask the guy, and it would be mutter if you had no options to ask the guy. But since it is possible to take care of it yourself without the malacha being done, therefore you're mechuyev to do it. All right, now the question is, if you have a neighbor or somebody who you're not friendly with, and they have the medication, so I'm not, or even if you don't know, are you mechuyev to go knocking on doors to find out if they have the medication or whatever it is that you need before asking the non-Jew? That already, I'm not so sure you're mechuyev to do that. It would only be in a case where you know for sure that you can get the malacha done, whatever is necessary to be done without asking the non-Jew. Right? Yeah. Then there's other options with shinui, which I think we discussed already, but maybe we'll discuss it again. There are other options that a yid can do malacha with the shinui, but okay, but that's not for now. Okay, so now then there's another din of eyes. Okay, eyes. The Gemara says for whatever reason. Scientifically, the Gemara says that eyes, if there's something wrong with the eyes, that somehow connects straight to the heart. So if there's a problem with the eyes, then you're allowed to, even if it doesn't seem to be bothering you too much, and if it would be a regular ailment, let's say of the mouth, you wouldn't. I mean, it's bothering you, but it's not bothering you enough to allow you to take medication. So then. So the mouth, obviously, you would not be able to take the medication, but if it's in the eye, then it's allowed. Okay, so basically anything that's by the eye is considered life-threatening, and you could do whatever it is that's necessary. So again, if it's something that we know with the fact it's not an issue, then meaning it's not a major issue, then it's not a problem. But any other decently strong issue with the eyes is already considered potential sakana. So you could take eye drops for eye infections like conjunctivitis are allowed to be taken on Shabbos without a doubt. Anytime you have to rinse the eyes out is also allowed. The only thing is if you have to put on ointment onto the eye, it would be better not to put it onto cotton because maybe you can have a schita issue. Right. So what about being poked in the eye? It's hard to know. One should ask a doctor to see exactly what's wrong. If somebody all of a sudden loses sight in the eye or seems to be losing something, that's clearly a life-threatening situation, and you do whatever you need to do. Right. But the point is that the eye, for whatever reason, is much more lenient. And therefore we're very makel with anything having to do with the eye. See, like if somebody's eyes are red, I'm not so sure that's considered a major eye ailment or not, and they get itchy, like sort of with the allergies. So if you know that it's allergies and your eyes always get itchy and red, that doesn't sound like a major enough ailment to allow taking medications. But anything other than that, stronger than that would be a problem. Fine. Now, a common question that's asked is exercising, stretching, and all those type of things on Shabbos. Can one stretch and do exercises, etc., on Shabbos? So we had said last week, I think it was last week, maybe it was 2 weeks ago, that any healing that can't be accomplished with medication was not included in the rabbinic Isser, in the Isser D'Rabbanan of Refua on Shabbos. Meaning, again, What was the issur of Refua on Shabbos? Because one may grind up medications, might grind up herbs, it's not stuff like that, which might be an issur d'oraisa. So therefore, they said that you're not allowed to take medications. But if medications being ground up could never possibly help whatever ailment it is that you're trying to heal, then the gezerah didn't apply. Okay, so we said, for example, if somebody falls and gets a bump, and you want to push down the swelling with a knife, that's not healing. I mean, it is healing, but it's not healing that the Rabbanon said is asur, because that bump cannot go down with medication. You can take Advil and sprinkle it onto that bump, it's not going to do anything. Right? So since that Refua, that healing cannot possibly lead to anything, so therefore it's not a problem of Refua. Right? So now what about exercise? So even if you say that exercise is considered Refua, but exercise is a Refua that cannot be accomplished by taking medication. Right? For example, somebody needs to stretch or somebody needs to massage, right? So can you take a massage on Shabbos, right? So the question, see, massage is, I'm sorry, let's hold off on massage for a minute till we clarify it. Stretching, right? So stretching to loosen up the limbs. So if your limbs feel fine and you just want to do the stretching because it feels good, so that's not even healing, right? That's not healing. That's for sure okay. But even if the limbs feel sore or feel numb or whatever it is, and you want to stretch to get that out, so that's not going to be considered. That's not one of the isurim of healing, because that, as far as I know, that cannot be healed by taking medication, right? If you have muscle pain, that can be healed. I don't know if healed, but it can at least be taken care of by taking Advil or something like that. But to stretch the muscles to make them feel better, since there's no medication that could be had for that, then therefore you would be allowed to do stretching exercises on Shabbos, right? So jogging and that type of thing, if you're jogging for health purposes, that would be allowed on Shabbos. Now, if one is going to jog on Shabbos, well, first of all, there's an issur of running on Shabbos. You're allowed to run to a mitzvah on Shabbos, but that's it. Your walking cannot be any faster than your regular standard walking on during the week. You cannot walk faster than on Shabbos. But if you're doing it because you don't feel well or something like that, then we'll be okay. And there's no issur of Refua about jogging, because it can't be accomplished with taking medication, right? But you have to know that you can't put on weekday clothing, and it can't look like a weekday activity if one were to go for a jog on Shabbos. As far as I know, I think the minhag in Klal Yisrael is not to go jogging on Shabbos. But if you saw somebody jogging on Shabbos, then they're probably not doing anything wrong, right? Now, physical therapy. Somebody wants to either do physical therapy on themselves, that a therapist told them to do these exercises every day, or even to have, we have a friend over who's a physical therapist. Obviously, they're not allowed to work on Shabbos, so they can't charge you without using all the loopholes that there is for charging for things on Shabbos. But if they decide they want to just do a little physical therapy, so if whatever physical therapy they're doing on you can't be accomplished by taking medication, then even physical therapy on Shabbos would be allowed, again, using the rule that we're saying, which is that anything that can't be accomplished with taking medication is allowed on Shabbos. Right, now, massage. So massages are a little bit confusing, because a massage, if something's hurting, so if the massage is there, the person's feeling fine, they just like the feeling of a massage, so that's for sure okay. That's not healing. Like we said with stretching. If somebody likes a massage on Shabbos, so then that's okay. But we said that it shouldn't be a heavy massage, because that would make it also like a weekday, because then it's like a weekday activity, right? But let's say somebody doesn't feel well and they want a massage on the muscle. So that's a little bit more confusing because sometimes the muscles can be taken care of by taking muscle relaxants and stuff like that. So since there is an option to take medication, so massages is not as simple. But if the particular massage that you want to get cannot be accomplished by taking medication, then it would be okay. And then of course, if somebody's really in a lot of pain, enough that they would lay down, so then there's no Isser Refua, so then they can get a heavy massage that way too, because there's no Isser Refua. How about a massage with oil? So I've been saying the last couple of weeks that really you can use oil on the skin on Shabbos. The Mishnah Brura brings from the Ramah, actually, I happen to have seen it this week, so I guess it's Basher, but he said that if it could be that just putting on oil on Shabbos, even though from the malacha standpoint, it's no problem because it's liquid, but it might be considered a problem of weekday activity. So depending on what society looks at as putting on oil on skin, may be considered weekday activity. So it should be preferably not be done, putting oil on the skin. I had said that it's mutter. It is mutter als malacha, but there's this angle of weekday activity on the oil. But a massage with oil certainly is considered a weekday activity. But to get it out of weekday activity, you'd have to do it with a shinui, right? If you do it differently than you do it on the weekday, then it would be done with a shinui. So it's interesting because I would have thought, and I have no idea how the massages work, but I would have thought that first they put on the oil and then they massage. So then on Shabbos it should be the opposite. The Gemara actually says it's the opposite way, that on Shabbos you should put on the oil and then massage, because the normal way to do it is massage the skin first and then put on the oil and then continue to massage. I don't know. I'm not a bucky in massaging, obviously, but whatever it is, if you're going to do a massage with oil, you'd have to do it differently than during the week, unless the person really doesn't feel well. If the person really doesn't feel well, then everything, all bets are off, and they can do whatever it is that they need to do with the massage. Okay. Again, if anybody has any questions, they're welcome to post it on that. So that's that. Now, fever, right? How do we look at fever? How do we look at fever on Shabbos? Do we look at that there's a chayla or not? Yeah. So I think what we had said, that even a light fever is considered already a chayla, and you're allowed to take medication. There's no isser of taking medications for somebody who has even a low grade fever. Now, what's with taking temperature on Shabbos to know whether you have the fever? Right? So if somebody has even light symptoms, you're allowed to take the temperature. The only thing is, it's not so easy to get the mercury thermometers anymore, like the old-time thermometers, which are, even though that's measuring, right? All thermometers are measuring, but you would be allowed to, because measuring for somebody who's sick, even if they're having light symptoms, is allowed to be done on Shabbos. But you got to use a mercury thermometer. What's with using a digital thermometer? Right? Oh, I'm sorry. One other thing before when you're using the mercury thermometer, so sometimes you have to shake it so that the mercury goes all the way down. That shaking should preferably be done before Shabbos, meaning if you're aware that you may need a thermometer on Shabbos, and you get a hold of a mercury thermometer, shake it down to, again, it's preferable to shake it down before Shabbos. If you didn't shake it down before Shabbos, then it's allowed, right? And then you're allowed to shake it down on Shabbos. Now, what's with digital thermometers? Because everybody only has digital thermometers, and this shaila, of course, comes up within a few minutes before Shabbos, a half hour before Shabbos. They're asking about using the digital thermometer, and it's usually too late to get the mercury thermometer. I don't even know if it's easily accessible to buy mercury thermometers, but certainly not an hour before Shabbos. So what do you do? So that really is going to be dependent on how sick the person is. If it's just a light fever, then I don't see any reason that you should use a digital thermometer. Right? Digital thermometer has two issues. One, pressing the button to turn it on, and two, it's writing. You're causing writing on the screen. So, but if it's somebody that needs it, then you turn it on with a shinui. Right? You just turn on the thermometer with a shinui, and then that will be okay. The thermometers that go on the forehead that change colors, that's not as good, but there's thermometers that have a strip with numbers on them, that is okay, because there we look at the numbers that they're already there from before Shabbos and it's just being colored in. But if necessary, both of them could be used, and a regular thermometer can be used too. What I tell people, and this I've heard from doctors, but obviously somebody has to discuss it with their own doctor if they know they're going to need a thermometer. What I understand is that if the medication brings down the temperature, then there's really no risk of, at least temporarily, there's no risk of meaning temperature, a fever, that happens because there's an infection in the body and the body is fighting something, so therefore the body heats up. So there's a chashash that there's an infection going on, so you have a problem. How do you know you don't have to take care of this infection on Shabbos? So you want to make sure you're taking the temperature to know if the body's fighting an infection. So, but if the medicine is bringing down the temperature, then there's really not such risk. So I tell people take medicine, see if it keeps the fever down. So you can push off. Usually you can push it off till after Shabbos. But if it's spiking through, meaning and it's not bringing down the temperature, then you have much more. Then you have much more of a problem. And then I certainly use the digital thermometer, because that's a sakana. We don't want to put anybody into any sort of sakana. Okay, so that's basically with fever. Now here's an interesting din that comes out from all of this. Now you're not allowed to take medication. Why? Because you might end up crushing the medications. No, you might end up crushing herbs, medications, and all that. If you do have a heter to take medication, and let's say somebody needs it to be crushed up because they're having a hard time swallowing it, then it's mutter, right? It's mutter to grind up the medication. You're thinking, 1 second, why? The whole reason why I'm not allowed to take medicine on Shabbos is because I might grind up the medication. And now you're telling me that if I'm allowed to take medication on Shabbos, I'm allowed to grind it up. So this is for a technical reason why it's mutter. There's a rule that's called ein toichen achar toichen. Once something is already ground up, it cannot be reground, meaning it could be reground, but there's no isser, meaning once something is a powder and then it's made into a solid, then it's no longer an isser of grinding, right? So, for example, if you want to grind up a challah to put it into soup, there's no isser grinding, because challah was flour and was already ground up, and it's sugar, whatever you put in there was already pre-ground. Once it's ground, there can be no isser of regrinding it, right? So therefore, you would be allowed to chop up the challah, etc., etc. Vegetables, on the other hand, like a whole vegetable, to cut it up into small pieces, it's a chashash of grinding. So, and that was obviously never, that's not considered grinding. So therefore, when you have a heter to take medication, most medicine, if not all medicine, came in powder form. Then they made it solid and put in some binders like wheat, which is one of the problems with medications on Pesach. Right? So they put in wheat, etc., and they make it into a solid. So then you're allowed to grind it right back down. So it comes out quite an interesting sort of, almost seems backwards type thing, where medication you're allowed to take you're not allowed to take medication on Shabbos because we're afraid you're going to grind it. But if you have a heter to take the medication on Shabbos, then our medications that are almost all ground up before, you're allowed to grind it up on Shabbos, right? So that is an interesting thing, and it's important to know. Let's say a kid, you don't have the liquid medication, you want to grind up the medication for a kid to take, so you want to grind it up and put it into a liquid, etc. So then that would be okay. Fine. Somebody posted something here. Let me see. Yeah. So somebody's saying that the headache, they get migraines, right? Yeah. So I think we discussed this a couple of weeks ago. This Shaila, meaning if you start getting a headache and you want to take medication, because if you don't take the medication, then the headache is going to get really bad. Then we said that's already considered like it's very bad, and therefore it's allowed, right? So if you know that, right, if you're starting to get a headache, you know that right now the headache is not bad enough to take medication, but there's a very good chance that it's going to get bad enough, then that's 100% mutter to take that medication, because we look at it like it's already you're already chayla enough for it to be a problem. Okay, so one last thing, and I think we're pretty much done. So we said that minors, kids, are considered chaylim. So for anything that a kid needs, a kid is considered a chaylim. So how exactly do you find it? That means if a kid starts jumping up and down that the kid wants an ice cream, does that mean you could go send a non-Jew to buy ice cream for the kid? So obviously that's not allowed. We're talking about when the kid is sick. So even though it may be seen to be nothing, then you're allowed. There's no issa refua, and they're considered a chayla. So medications for children, there's no problem. Now, what age kid? I think we discussed it a little bit. So 9-10 years old is certainly considered up till 9-10. Again, depending on the maturity of the kid. If the kid is mature and they can deal with things, so then it would be okay meaning then you 7 years old. Anything less than 7 for sure is considered a chayla. If they're not feeling well, they're considered a chayla shem b'sakon. You can do whatever it is that you need to do for them. Obviously, it's a daraisa, but a guy can be asked to do whatever it is that the kid wants. Like the two classics are the lights on in the kid's room. So then for sure you could ask a guy, you probably could ask a guy for, even if an adult, the lights on in the room to shut it off. We said already once before, turning on is not as simple, but for a kid's room, if the room is dark and the kid is scared of the dark and they won't sleep, you could ask a guy to turn on the light for the kid. Kid to take vitamins, if the doctor says that the kids should take vitamins, and they can take the vitamins on Shabbos. We already discussed last week that vitamins should be taken either before Shabbos or after Shabbos. It's not usually necessary to take them specifically on Shabbos. One last thing, anxiety medication, right? Unfortunately, very common nowadays that people are on medication for anxiety, ADHD, all these type of things. The poskim do say that somebody being anxious is considered a standard regular chayla, and therefore somebody who's on anxiety medications or ADHD medications would be allowed to take the medications. Certainly, we discussed last week taking medication as preventative, right? Preventative medication is allowed because meaning when you're not feeling sick, so you're taking it just so you shouldn't feel sick, then that's okay. So if somebody knows they have to take anxiety medication, so take it before you feel the anxiety coming on, or if one needs ADHD medication, so take it before you feel the ADHD, any sort of symptoms coming on, and then for sure it's okay. But even if not, we look at anxiety that it is considered a chayla, and therefore it is okay. All right, I think that's it for pretty much the Hilchos Refua. they're changing the clock soon, so I don't know exactly sure what we're going to do. I think next week maybe we'll have a shir on Hilchos Purim with a week and a half before, with all the Mishlayach Manas questions, etc. Unless somebody has other suggestions. So then, yes, allergy medication is okay for preventative use. So I think next week, Bez Hashem, we'll do Hilchos Purim, and then we'll see maybe do Hilchos Pesach or whatever it is. Okay. A good talk, everybody. A good yarn. Everybody should be good, and we should hear only good news.